Good morning, everyone. My name is Emily Bezic. I'm a PhD researcher at the Centre for Clinical Brain Sciences in the University of Edinburgh. Today, I'm going to present our current work, which is a systematic review of wearable devices to evaluate motor progression in people with motor neurone disease, or amyotrophic lateral sclerosis, as it's often referred to. As you know, motor symptoms in MND are often evaluated using the ALS-FRS, a disease-specific functional rating scale. This questionnaire-based assessment provides a measure of progression in the clinic and also as an outcome measure for clinical trials. The ALS-FRS provides a composite score of physical functioning and is reliant on patient reporting and subjective recall. Wearable devices such as activity monitors and accelerometers offer a sensitive and objective alternative to assessing data collection. These devices have been explored in other neurodegenerative conditions, are even used as outcome measures in Parkinson's trials. As this is an emerging and exciting area of MND research, we wanted to design a systematic review to look at the current landscape. In our poster, we present 15 studies which have reported using this kind of technology to evaluate motor progression. We excluded studies where the devices were used for assistive or rehabilitative purposes, or devices evaluating aspects of MND unrelated to motor pathophysiology. These studies included a total of 680 people with MND, an average of 49 per study. The type of device used varied depending on the area of the body assessed, the use of comparative participants, and the clinical endpoints in mind. Accelerometers were the most commonly used device, included in 8 studies. Activity monitors were second most commonly used, included in 6 studies, with 6 studies utilizing them to monitor general function. 3 studies used specialist apps to collect data directly from participants and indirectly using their smartphones. Microsoft Kinect sensors were used to evaluate the participants' arm function in 2 studies. 12 of these 15 studies used the ALS-FRS data to evaluate the concurrent validity of these devices. Ultimately, our review found that although this is a promising and emerging area of ALS research, more studies need to be done. We need to further explore how these devices can be useful to monitor disease progression and their potential suitability as outcome measures in clinical trials. I'll be standing by the poster if you have any questions or comments. Thank you for listening.